Welcome back, students. We are continuing with Modular 9, Mental Health, Substance Abuse, and Developmental Disabilities, and we are starting video 4. So this is 4 of 4. We've got a few slides we're going to get through on this, so hang on. We'll get through these as quickly as possible. So we've talked a lot about substance abuse, about alcoholism, and kind of given you an overview of the various different types of substances that people can use and utilize and that can have an impact on their ability to be able to function. And now we want to take a look at the social and economic costs of substance abuse. Many folks in the United States feel that substance abuse is one of the most serious public health problems in the United States, often resulting in more deaths and disabilities each year than any other cause. I think the thing that comes to mind for me is so much about how we've heard about the how we've heard about opioids. I'm sorry, I just couldn't get that word in my head. Opioids over the last several years. The writing of prescriptions, people becoming addicted to opioids, and those often are serving as a pain reliever on a very extreme level. And just the number of deaths that have occurred in the United States over the past several years as a result of opioid use. So definitely something that we are currently seeing in our country right now. The economic cost of alcoholism and alcohol abuse in the United States in 2019 was estimated to be $420 billion. Upwards to 18 million citizens meet the definition of being alcoholics. 76 million Americans, about 43% of the US adult population, have been exposed to alcoholism in their families. And there are nearly 27 million adult children of alcoholics in the United States. There's some unique issues around adult children of alcoholics that hopefully we're going to find some time to talk about in an upcoming modular. Substance misuse can be highly correlated with child abuse and neglect, spousal abuse, homicide and other violent crimes, and serious traffic accidents. So you begin to see again where we come back to, you yourself may say, I don't anticipate that I'm going to work as a social worker in a substance abuse program. So maybe this is not information that's as relevant to me. But what if you're working in a child abuse program or a child abuse prevention program? What if you're working in a domestic violence program? It's going to be important for you to have a working knowledge and some understanding about alcohol and other substance use relative to those clients that you'll be working with in those settings. According to SAMHSA, substance abusing parents are almost 3 times more likely than parents who are not substance abusers to abuse their children, and more than 4 times as likely to neglect them. 3/4 of survivors of domestic violence by an intimate partner report that the perpetrator had been drinking. Alcohol is also reported as a factor in the majority of sexual assaults. We've certainly seen that in terms of the preponderance of sexual assaults on college campuses and the relationship to alcohol use. Children who grow up in families where substance abuse is a problem are at risk of becoming substance abusers. So 25% of males, 10% of females who grow up in these families, either they become substance abusers themselves, either alcohol or drugs. Even those who do not develop substance abuse problems themselves often develop other addictive behaviors or emotional problems. Fewer women than men repeat the pattern of substance abuse, but women are often that have been raised in a family where substance abuse has been prevalent, often will find themselves in a relationship with a person who is a substance abuser. Who are the at-risk populations for substance abuse? Adolescents, the elderly, people of color, again, some of those same populations that we've talked about before. Obviously, the danger for adolescents is that their brains are still developing, and the impact of the use of alcohol or other drugs in terms of brain development can be significant. They could be using alcohol and other drugs to self medicate to manage pain from other problems. That is often the situation in terms of the LGBT community. Elderly, higher death rate due to alcohol misuse, alcohol and other drugs used to manage loneliness and isolation. Again, going back to the scenario we talked about earlier regarding mental health, for those who are older in terms of issues around retirement or death of a spouse. People of color, Native Americans have higher rates of alcohol-related homicide, suicide, and car accidents. Half of Native American-born children are born with either fetal alcohol syndrome or fetal alcohol effect. People of color are more often people living in poverty with limited access to healthcare and employment, contributing to their risk for substance misuse. Interventions for people of color need to be culturally relevant and sensitive. Women who misuse drugs are different than men, more likely to use legal or prescription drugs. They're more likely to live in a family with other drug users, use drugs in isolation, use multiple drugs, less likely to seek out treatment, may have less support for entering into treatment. Recovery programs for women need to address multiple issues. Children who are often impacted through abuse or neglect, we need to see increased efforts in recent years to pay attention on infants born to mothers who misuse drugs or alcohol during pregnancy, because we know that there's the risk of fetal alcohol syndrome in those particular cases. There are interventions that are associated with substance abuse. Probably the one that most folks have heard of in the past would be Alcoholics Anonymous, which was founded in 1935 by Bill W. and Dr. Bob. They found that they could maintain their sobriety by supporting one another and following a formal program of recovery known as the 12 Steps. AA is still in place today, continues to be used by alcoholics in recovery. It helped to shift the perception of alcoholism from that moral issue to more of a disease concept. And the National Council on Alcoholism, which was founded in 1944, also contributed to the changing viewpoint on alcoholism. Treatment options. Not all alcoholics respond to the same combination of treatment options. Here are sort of the typical treatment options that would be available actually to someone who's abusing alcohol or any other drug. There can possibly be a consideration for an inpatient stay. So this is actually relocating to a facility, usually somewhere between 30 to 60 days, and it may involve detoxification in terms of alcohol. You could find yourself using an outpatient program, provides an opportunity for the patient to receive support while still operating in the environment they will need to return to. Very positive in that regard. Individuals released from a treatment program are encouraged to use community-based programs such as AA or Narcotics Anonymous, NA, may also use aftercare programs associated with the treatment facility. And many programs incorporate the family members of the alcoholic as part of the treatment program. And that's the family systems model. So in some situations, a person may start in an inpatient program, transition to an outpatient program, and then transition to a community-based program. Some people may not be able to access inpatient care, but may do outpatient, start with outpatient, and then transition to a community program. Some programs are taking a cognitive behavioral approach to treatment, particularly with adolescents and people in the criminal justice system. And a cognitive behavioral approach really emphasizes the consequences for misusing substances and other behaviors. Alternative peer groups takes into consideration the importance of peer support, and programs serving women are now including things like the patient's children in the treatment program, both in residential and outpatient services. So having their children with them creates probably elements that would result in more of a success in terms of completing the program, as opposed to being in a treatment program without your kids. Persons with disabilities. So we are now ending our discussion on substance abuse, and we are going to take a look at persons with disabilities. This is the largest minority group in the world. 10% of the entire population experiences disabilities in one form or another. Some are very minor and have very little effect on a person's ability to function. Others experience a disability that's major and lifelong. Some disabilities are visible, while other disabilities are invisible. Disabilities can be the result of illness, war, an accident, or as a result of just growing older. For many, the biggest obstacle of having a disability is the stigma a community places on that particular person. So the idea of thinking about them as a person who what they cannot do, as opposed to what they can do. So that's where the stigma comes in. The Americans with Disabilities Act, or the ADA, passed in 1990 and was amended in 2008. The ADA addressed physical and mental conditions and the conditions impacting major life activities. It took a look at physical disabilities, those who were impacted in terms of mobility, as well as hearing and vision, disabilities that are health related, so things like persons living with HIV/AIDS or diabetes, intellectual disabilities, those who impact a person's cognitive ability, their ability to be able to process and think, emotional disabilities, conditions such as depression and or schizophrenia, and then finally learning disabilities, things like attention deficit hyperactive disorder or ADHD, as well as dyslexia. The Developmental Disabilities Assistance and Bill of Rights Act define developmental disability as a severe chronic disability of a person 5 years of age or older, which is attributed to a mental or physical impairment or combination of mental and physical impairment, is manifested before the person attains the age of 22, is likely to continue indefinitely, results in substantial functional limitations in 3 or more areas of major life activity. So again, school, work, home, and reflects a person's need for lifelong services and support. So when you're looking at giving a definition of who is a person who is experiencing a disability, these are the kind of things that you would take a look at. Developmental delays happen when children have not reached changes in skill development during predictable periods. So I'm sure that most of you are familiar with sort of the developmental milestones that children are expected to reach as they grow older. And they are many and varied. And the concern about developmental delays really happens when you start to see a child who repeatedly is not making those benchmarks. They are not hitting those milestones. Attention is being paid to early identification of children with, excuse me, with developmental delays to try to prevent more serious disabilities later in life. And there are definitely severe risk factors for developmental delays: genetics, metabolic disorders, poor maternal nutrition, exposure to toxins, exposure to infections passed to baby during pregnancy, premature birth as a result of poverty, poor nutrition, or lack of care. So in taking a look at all of these different programs and all of these different considerations, developmental disabilities, alcohol and substance abuse, and mental health disorders, what is the role or the opportunities for social workers? Well, we know that social workers comprise the largest group working in public mental health services. Clinical social workers often working in mental health settings must meet the qualifications of the National Association of Social Workers, Academy of Certified Social Workers, and be state licensed. This ACSW certification requires a master's in social work, 2 years of social work experience under direct supervision, and a satisfactory score on a competency examination. Each state has their own requirements for state licensing of a social worker. Social workers serve as both service providers and are often the individuals serving as the executive director of these types of programs. A bachelor's in social work degree prepares social workers to serve in a variety of capacities: crisis intervention programs, various hotline programs, counseling adolescents and their families, working in state hospitals, community living programs, working in state schools, community programs for individuals with developmental disabilities, and school-based services and drug treatment programs. Social workers can be part of multidisciplinary teams working with other professionals in developing and implementing a case plan for a particular client. So you may find yourself working in a team with, someone who has a medical background, somebody who maybe is a job specialist, somebody who is maybe more inclined to be providing psychotherapy. And there's some great elements about working together in a multidisciplinary team. Social workers can work as case managers, be responsible for monitoring cases that ensure that clients receive the needed services, not provided services directly, but coordinating the services of other resources for the client. So you're linking that person. Go back to those roles that we talked about: advocacy, linking, all those things. Case manager may make sure that the clients are meeting expectations of the case plan, are functioning successfully, and they assist their clients in problem solving about jobs, family issues, managing finances, health issues, and establishing relationships with resources. So in conclusion, services for individuals with mental health and addiction issues and disabilities have changed significantly over the past decade. Current issues in these fields ask questions as to the legal rights of clients and patients. Should they be able to refuse or demand treatment? What about scarce resources? How best to use them? What's the role of the federal and state and local government in providing services? What's the attention to substance use disorders? Potential expansion of treatment facilities, the need for more effective programs for women, people of color, those who are homeless, and individuals in rural settings. And there are roles in all of these areas for social workers today and in the future. So that concludes the presentation on Modular 9. But before I leave you, I wanted to take an opportunity just to walk you quickly through Modular 9 and just make sure that everything is clear. So here are your learning objectives, and here's the goals of what we hope that you're going to experience and achieve as a result of participating in this. The 4 videos that have been recorded will be added to the modular. But in addition, there are some other elements that I want to make sure you're aware of. As always, here's the PowerPoint for the modular, all 46 slides. So this was a big modular. This is a couple of interesting videos that I wanted you to take advantage of. The National Alliance on Mental Illness, or NAMI, some information on how families are supported in terms of family members who have members of their family that are experiencing mental illness. This is this is a TED Talk, not too long, Dr. Carolyn Greer, on the issue of substance abuse and stigma. And so I thought that it was really interesting and made some interesting points that were worth considering. Again, another NAMI talk. This is a son's perspective on mental illness. So this is Theo Bennett, who talks about what his experience has been like being raised by a father who has experienced mental health issues. And this was one that I came across just this year. Kevin Love, who is a professional basketball player with the Cleveland Cavaliers, talks about his own battle with anxiety and depression. So I just felt like it really hit home that it doesn't matter who you are or where you live or how much money you make or what your job is. Anybody could find themselves dealing with mental health issues. Here is the discussion board for Modular 9. I took a little bit of a different approach with this. This is really kind of a little bit of a self-help video that I want you to watch and then address the questions. And it talks about what are some mental health issues that could be happening for anybody, including you and me, relative to living during the time of coronavirus, or COVID-19. So what I've done is I've asked you to take a look at the video. It's a little, I think it's right around 30 minutes long. And I'm asking you to answer the 4 questions. You'll be evaluated on your ability to answer these questions and also just your writing ability and that how effective were you able to communicate your responses. As always, you should structure your discussion board response by restating each question below and then providing your response. I really want to encourage you. Some of you are losing points because you simply are not restating the question and then answering it in the discussion board. So please make sure that you're doing that. Your initial responses are due on Saturday, October 31st, and your replies are due by Sunday, November 1st. This opens on Monday and is due on November 1st. And then here's the quiz for Modular 9. So, okay, that concludes today's lecture. I hope you guys are doing well. Please start thinking about that final paper that you need to write. Everything's available on Canvas for what you need to be able to do. It's not due till December, but there's some steps that you need to take beforehand. You've got to find somebody to interview and set that whole interview up and all of those kinds of things. Please be taking a look at your grades and make sure that if you're thinking about ways that you want to try to improve your grades, think about the extra credit assignments that will be coming up later in the semester. Think about what can I do to do better on the discussion boards, those kinds of things. And as always, if you're interested in talking about any of these things, you can join us on Tuesday nights at 6 o'clock on the Zoom meeting that we call office hours. And if that doesn't work for you, I'm more than happy to meet with you individually. So I hope you have a good rest of your week or whatever time you're looking at this. Good day. And we will call it good now. Thanks, guys.